Hello everyone, my name is Shelby Riles and I'm with Community HealthWorks. We're a nonprofit organization working to make Georgia communities healthier. The topic of our presentation today is the concept of early detection. Early detection is life-saving. We're going to be going over the screening methods that make early detection such. The goal of a screening is to detect cancer early so that it can be taken care of early. The later that cancer is detected, the more likely it is that it has developed into a stage that's going to be more detrimental to your health. Screenings mitigate the likelihood of you developing a late-stage cancer because screenings are typically conducted before the patient has any symptoms of the disease. So the later that cancer is detected, the less likely that the treatment will be successful. Screening routinely effectively reduces the likelihood of developing late-stage cancer because they are conducted before any symptoms are there. So when we're considering the early detection of breast cancer, the screening method that you're going to think of is a mammogram. Mammograms should begin for women at the age of 40 to 50 if you have an average risk. This may change depending on your personal risk factors. Mammograms are the best method of detecting breast cancer early. A mammogram involves taking an X-ray of the breasts to assess for cancer. A mammogram is the most common breast cancer screening, and they're an efficient method of detecting breast cancer early, as this is a preventative screening. So when we're talking mammograms, women should begin screening no earlier than 40 and no later than 50, and you should consider ending at the age of 75. You should screen at least every 2 years, but it can be as frequently as every year. This depends on your personal risk factors. If you're at an increased risk for developing breast cancer, or if you notice breast abnormalities, it's common for mammograms to be completed at an earlier age. Enhanced screening is recommended if you have a 20% or greater lifetime risk of breast cancer, a personal or family BRCA1 or BRCA2 gene mutation, or a personal history of radiation therapy. So now we're going to think a little bit about cervical cancer. And the cervical cancer screenings, there's two different kinds, but in general, women aged 21 to 65 are those that should be getting these done, and they're for people at an average risk. So I said there's two types. The first type is the Pap test. The second is the HPV test, and they're both used to screen for cervical cancer. The Pap test can find abnormal precancerous cells in the cervix, while the HPV test screens for the presence of the HPV virus that causes the cells to become abnormal. So to get a little bit more specific into those recommendations, women should begin Pap test screening at the age of 21, and you should begin HPV screening at the age of 30. You can consider ending your cervical cancer screenings at the age of 65. You should have a Pap test every 3 years and the HPV test every 5. If you're at an increased risk, enhanced screening is recommended. You're at an increased risk if you have things like a personal history of cervical lesions or cancer, if you have a compromised immune system, or if you've been exposed to diethylstilbestrol. So now we're talking about the early detection of colorectal cancer. And so colorectal cancer screening is recommended for everybody when you turn 45, and you can end getting colorectal cancer screenings at the age of 76. Now, those recommendations are if you have an average risk. As always, if you're at an increased risk, there's going to be modifications to that. But there's numerous methods of screening for colorectal cancer, which almost always develops from precancerous polyps in the colon or the rectum. Screening tests are used to discover these growths so they can be removed. Screening options available involve stool-based tests, which involve Cologuard, which tests for DNA in the stool, and FIT test, which tests for blood in the stool. And then, of course, the colonoscopy, which is an invasive procedure, but is the only one that can actually remove the cancer at the time of detecting it. So you should begin colorectal cancer screening at the age of 45, consider ending at the age of 76. And now with colon cancer, colorectal cancer, screening frequency depends on your results as well as your personal risk. So with a colonoscopy for normal risk, it's going to be in general every 10 years, but with the stool-based tests, you're looking at usually about 3, sometimes even once a year. It really all does depend on your personal risk. So enhanced screening is recommended if you have a personal or a family history of colorectal cancer or of certain types of polyps, even if they're not cancerous. If you have a personal history of inflammatory bowel disease or IBS, or IBD, as well as a personal history of radiation therapy or certain genetic syndromes. And so what I like to tell people when we're talking about colorectal cancer is it's really important to establish a relationship with a physician. Now we're going to be discussing the early detection of lung cancer. So low-dose computed tomography scans, or an LDCT scan, is used to screen for lung cancer. This involves using X-ray technology to gather images of the lungs so that a doctor can assess those images for any abnormalities. This is highly recommended for individuals that have a history of heavy smoking or are current smokers and are between the ages of 50 and 80. We'll talk a little more about those specific qualifications. So, like we just said, with the lung cancer screenings begin at the age of 50 and you should consider ending at the age of 80, and those are a yearly screening. So to qualify and for those recommendations, if you currently smoke or have quit within the last 15 years and have a 20-pack year smoking history, if you multiply the number of packs you smoke per day by the number of years you smoked them, you can get your pack year smoking history. And so with lung cancer screenings, this is going to be one where it's really important to discuss with a doctor openly and honestly about your history with smoking, because you'll need to be able to assess for lung cancer and do those preventive screenings if you are at an increased risk due to smoking. Now, last but not least, we're talking about prostate cancer screenings. Men aged 50 to 70 with an average risk, this is for you. The prostate-specific antigen test, also known as the PSA test, and the digital rectal exam, or the DRE, are both screening methods for identifying prostate cancer. Following those tests, the doctor may perform an ultrasound, an MRI, or collect a sample of tissue to assess the cells. Both the PSA test and the DRE are tests that can be completed during your annual wellness visit at your doctor. So it's important to make sure you're talking with him or her to make sure you're getting those tests done. So, like I was just saying, you should begin conversations with your doctor about prostate cancer screening at the age of 50, and you should consider ending at the age of 70. And again, kind of like with colorectal cancer, for prostate cancer, the screening frequency depends on your screening results and your personal family history. So enhanced screening is going to be recommended if you are African American, which is actually, there's not actually science knowing why it is that African Americans are at increased risk, but it's just, that's what the data shows, and so we know that's a risk factor. And then also a family history of prostate cancer. That's going to mean that you've got an increased risk for it. So we've talked about a lot of different screening methods throughout this presentation, that for breast cancer, cervical cancer, colorectal cancer, lung cancer, and prostate cancer. But the bottom line across all is that screening saves lives. This is because detecting cancer early means it can be taken care of early, and those screening methods are a preventive measure. They should be being completed prior to symptoms developing. Of course, if you develop symptoms of any of these cancer types, it's very important to get an appointment with your doctor. You can learn more about all of these screening types and these cancer types on our website. And speaking of our website, here it is. You can reach us at www.chwg.org. Feel free to follow us on social media and reach out if you have any questions. Thank you so much and have a great day.